Alright, my name's Reggie Gilstrap, and this is my head-to-toe assessment. Just me, the student nurse. 5 for patient privacy, hand hygiene. Oh, Mr. Gilstrap, how you doing?
I'm good, how are you?
I'm doing alright. My name's Joey. I'm going to be your student nurse for the day, okay? Sorry, that was a mosquito. Alright, so what I'm here for is today we're going to conduct a head-to-toe assessment. It'll probably take between 20 and 25 minutes. Is that okay with you?
Mm-hmm.
Alright, do you have any questions before we get started?
No.
No? Okay, so there's a couple things I'd like to do before we get this assessment started. So, the first thing, can you tell me your name and date of birth, please?
Talon Gilstrap, August 30th, 2008.
Awesome, Talon. Alright, and do you have any allergies?
Nope.
Okay. Alright, so no allergies? Alright, so the last part before we start this assessment is I'd like to assess your pain level before we get started. On a pain scale of 0 to 10, 0 being no pain, 10 being extreme pain, how would you rate your pain right now?
0.1.
0 or 1, so basically, so no pain. Okay, alright, that's good. Alright, so let's go ahead and get this assessment started. And the first part of this assessment is going to be based off of your appearance, okay? And what I'm looking for are any signs of acute distress. So that would be you kind of acting erratic and not appropriate for the situation that we're in, which you're not doing any of that. You're not showing any signs of acute distress. I want to check your level of consciousness, alright? So can you tell me your name?
Talon.
Okay, Talon. Can you tell me where you're at?
The house. My house.
Your house. What time is it about right now?
4:30.
4:30. In the morning or at night?
At night.
At night. Okay, so it's 4:30 p.m. Okay, and can you tell me why you're here?
General checkup.
A general checkup. All right, that's good. All right, awesome. So, you answered all my questions correct. So we would say that you're alert and oriented times 4. Okay, person, place, time, and event. All right. The next thing that I want to check is your facial expression, your mood, and your speech. I've been looking at your speech since you've been talking, making sure that you're making sense when you speak. You're being clear, concise, speaking in complete sentences, which all you're doing all that. Your mood is appropriate for the situation, and your facial expressions are matching the situation. They're appropriate. You're smiling, you're nodding. They're appropriate for the questions that I'm asking, okay?
Mm-hmm.
So the next part of this assessment is going to be your skin and nails, okay? The first thing that I want to look at is I want to look at your skin, and what I'm going to look for are any signs of lesions, wounds, or incisions. In a hospital environment, my patient would be wearing a gown, so I would expose his skin so that way I can see him. For the purpose of the video, he's got clothes on, but just be aware that if this was in a hospital setting, my patient would be in a gown, and I'd look at all his skin. So I'm looking, I'm inspecting. Can I look at your back, please? All right. So I inspected your front, or your anterior, posterior, all of it. I don't see any signs of lesions, wounds, or incisions. Your your skin color is appropriate for your ethnicity or race. Next, I want to check your cap refill. Okay, so your cap refill, I do it by pressing on the bed of your nail. So can I see your hand real quick? All right, that's good. Can I do the other one on the other hand? Let's do it now. All right. So cap refill was less than 2 seconds, so that's really good. Okay. Your nail color was pink. I didn't see any signs of clubbing. Can you do this real quick for me? Just put your nails together. Yeah, no signs of clubbing. The next thing I'm going to do is check your skin temperature. So what I'm going to do is, on the top of my hand, I'm just going to place it against all your skin, on your arms, and go down your legs. Alright? And then just to assess your skin temperature, okay? Alright. So your skin was warm and moist, alright? So that's appropriate for your skin, okay? It's healthy. So we're done with assessing your skin and your nails. Next thing that I'm going to assess is your head, your face, and your neck, okay? Now when it comes to that, the first thing that I'm going to do is I'm going to inspect and palpate your head for any lesions or any infestations, okay? Alright, so I'm inspecting your head. I don't see any signs of any lesions or infestations. Is it okay if I touch your head? Alright. Alright, so I don't see any signs of lesions or any infestations, okay? The next thing that I'm going to do is I'm going to check cranial nerve 5. And how I'm going to do that is you're going to close your eyes and I'm going to touch you with something soft first all around your face. And you're going to tell me when you feel it, okay? Then I'm going to touch you with something sharp and you're going to tell me when you feel it. And then after that, I'm going to go between soft and sharp and you're going to distinguish if it's sharp or soft, okay? So go ahead and close your eyes for me. And just tell me when you feel it. Just say yes, okay?
Yep. 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 Yep.
Alright. So was that soft or sharp?
Soft.
Okay. Alright, go ahead and close your eyes.
Yep. 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 Yep.
Alright, open your eyes. Was that soft or sharp?
Sharp.
Alright. Now the next part is going to go between soft and sharp, and you're just going to tell me if it's soft or sharp, okay? Alright, close your eyes for me.
Soft. Sharp. Sharp. Soft. Sharp. Soft. Sharp. Soft.
Alright, very good. Alright, so you passed everything there, okay? So your cranial nerve 5 is intact. Can you go ahead and chew for me real quick? Open your mouth. Okay, very good. Alright. So next we're going to move on to cranial nerve 7. So I need you to smile for me real quick. Alright, can you frown? Wrinkle your forehead? Alright, very good. Alright, so cranial nerve 7 is intact. Now we're going to go on to cranial nerve 11, okay? So what I'm going to do is I'm just going to push downward pressure onto your shoulders, and I want you to lift them up, okay? Alright? Alright, so I'm going to place my hand on the side of your cheek, and I just want you to place pressure on that side, okay? Alright? Other side? Alright, very good. Alright, so cranial nerve 11 is intact. The next part of this inspection is going to be your eyes, okay? So all I'm going to do is first I'm going to inspect for any redness or discharge. Alright, so can I look at your eyes? I don't see any signs of redness or discharge. I'm going to look at your, pull your lower eyelid off. No, I'm going to pull your lower eyelid down so I can look at your conjunctiva, and then I'm going to look at your sclera, okay? So your conjunctiva is pink and moist, no signs of discharge or redness. Your sclera is white with no signs of redness or discharge, okay? So it looks good. So the next thing that I'm going to assess is something called PROA, okay? So I'm going to need you to look at me for this, and what I'm going to do is I'm just looking at your pupils first. I'm looking at the size, okay? So your pupil size is within normal limits, okay? I'm making sure they're equal, which they are. They're both brown. And now I'm going to get my pen light. I'm going to see if they're reacting to light, okay? What I'm looking for is for me to shine a light in one pupil and for both pupils to dilate, okay? And I'll do it on one side and then I'll do it on the other, okay? Here, 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 here. Alright, so they were reacting to light. Now I need to check your near vision and far vision, okay? Can you read the time on that clock for me?
440.
4:40, okay. And then I want you to follow this light for me, okay? Just stare at this. Alright, very good. So we would say that your eyes are PROA. They were the pupil size was appropriate, they were equal, round, reactive to light, and accommodation, okay? So they looked fine. Now the last part of this is I'm going to assess cranial nerves 3, 4, and 6, okay? And what I'm going to do is something called the cardinal fields of gaze, okay? So I'm going to move this pin light in 6 cardinal directions, and I just want you to follow the pin light, okay? Are you ready? Alright, very good. Alright, so cranial nerves 3, 4, and 6 are intact, okay? The next part that I'm going to do is your ears. And what I'm going to do is something called a whisper test, okay? What I'm going to do is I'm going to whisper a word in one ear, and I'm going to cover the other ear up. And then I just want you to repeat to me what you said, and then I'll do it on the other side, okay? Good job. All right, that was really good. All right, and then what I'm going to look at is just the external ear and see if I see any signs of redness or discharge. I don't see any signs of redness or discharge, and no signs of redness or discharge. Okay. So next, we're moving on to the nose. Okay. And what I'm looking for is I'm just going to inspect and look at your internal structures, and I'm looking for any signs of deformity, um, symmetry, um, and any redness or drainage. Okay, so can I look? All right, it's symmetrical. I don't see any signs of drainage, redness, no discharge, no inflammation. Okay, all right, and then I want to check bilateral patency. So can you do me a favor? Cover your left nostril and try to breathe in and out of your right. Can you do it? All right, now can you do it on the other side for me? Did you do it? Awesome, very good. Okay, so your nose is good. All right. So I didn't see any signs of drainage, no inflammation, no redness. It was symmetrical. I didn't see any issues inside of your nose at all. It was good, and it was bilaterally patent. Okay, or patent. So the next thing that I'm going to check is your mouth and throat. Okay. So I'm going to have you open your mouth, and what I'm going to look at is your gums, your lips, and your tongue. And what I'm looking at is color and whether or not it's moist in there. Okay. And that'll be the first part. Okay. So can you go ahead and open your mouth? All right, you can go ahead and close. All right, so your gums, tongue, and lips are all pink and moist, okay? Now I need to assess cranial nerves 9 and 10. What I'm going to have you do is I'm going to have you go ah, all right? Your soft palate and your uvula should rise when you say ah. I'm also going to stick a tongue blade in there, and I'm going to test your gag reflex, okay? Do you have any questions before we do this? Okay, I'm not actually going to gag my patient, but in a real life scenario. All right, can you open your mouth and say ah? All right, your soft palate and uvula are raising. I'm going to test your gag reflex. All right, very good. All right, so that was cranial 9 and 10, okay? It was really good. Now I need to check cranial nerve 12, okay? So what I want you to do is I just want you to open your mouth and I want you to move your tongue from one side to the other, okay? Can you move it to the left? Can you move it to the right? Very good. Awesome. That was really good. So cranial nerve 12 is intact, okay? The next part of this assessment is your respiratory system, okay? So first, what I'm going to look at is I'm looking at your chest to see if you're using any accessory muscles when you're breathing. Accessory muscles would show like contraction in your neck and right here in your upper chest. It would show that you're having trouble breathing. You would be tripoding, which means leaning over, like I said, contracted, okay? You're not using any accessory muscles when you're breathing. You're very calm. You're sitting upright. So you're not using any accessory muscles while breathing, okay? The next thing that I'm going to do is I'm going to auscultate your lung sounds, okay? So how I'm going to do this is I'm going to do this in a Z pattern. I'm going to listen to the front, and then I'm going to have you stand up, and I'm going to listen to the back, okay? Do you have any questions before we get this started? When I place it down, you're just going to take a breath in and a breath out, and then I'll move it, breath in, breath out, and so on, okay? Okay? Go ahead. So that was your left upper lobe. This is your right upper lobe. Right upper lobe. Left upper lobe. Right lower lobe. Left lower lobe. And I'm at, on your right, you have a middle lobe, and I'm going to hit that right now. Okay, go ahead, breathe in and out. All right, and that was your right middle lobe. Go ahead and stand up for me. We're going to do the same thing on the back, okay? Left upper lobe, right upper lobe, right upper lobe, left upper lobe, left lower lobe, right lower lobe. All right, you can go ahead and take a seat. So I didn't hear any abnormal sounds, okay? Um, it all sounded fine. I did your anterior first, and then I did your posterior side. I didn't hear any abnormal sounds at all. The next part of this assessment is going to be your cardiovascular and your peripheral system, okay? The first thing that I'm going to do is I'm going to palpate your carotid pulses, which are located right here in your neck. I'm going to do one at a time, okay? And that's just to make sure that's the way your brain gets blood. So I don't want to close off both ends, because then you could pass out, okay? So I'm going to do one and then I'll do the other, okay? All right, did it for 30 seconds. I would rate your pulse at a 2 plus. I didn't feel anything abnormal, okay? Next, I'm going to assess you for any signs of edema. I'm looking at your arms, your stomach, and then all your legs. And edema would show kind of a backup of fluid within your body, and it would show inflammation or swelling, like in your ankles, your feet, your legs, your arms. You don't show any signs of edema, okay? The next thing that I'm going to do is I'm going to go ahead and listen to your heart now, okay? I'm going to listen to the diaphragm first, which is this part, and then the bell, okay? And I'm going to call out the location and the structure that I'm listening to, okay? Do you have any questions?
Nope.
Okay. All right, can you sit up straight for me? So the first one that I'm going to listen to is called your aortic valve, okay? And that's located on your right sternal border, second intercostal space, okay? All right. Next is your pulmonic valve, which is left sternal border, second intercostal space. All right. And then Erb's point, which is left sternal border, third intercostal space. And then your tricuspid valve, which is left sternal border, fourth intercostal space. And then your mitral valve, which is left midclavicular, fifth intercostal space, okay? All right, I didn't hear anything abnormal. I'm going to go ahead and switch to the bell now, okay? All right. So your aortic, pulmonic, Erb's point, tricuspid, and mitral. All right. I didn't hear any abnormal sounds, okay? Next, I'm going to palpate, or I'm going to feel your radial pulse. Your radial pulse is located on your wrist on the thumb side, okay? So can you go ahead and flip your hands? There you go. All right. I felt them for 30 seconds. I would rate your pulse at 2 plus, okay? Rate rhythm was really good. Nothing abnormal, okay? Next, I'm going to check your posterior tibialis, okay? That's located right there on your ankle. So can you uncrop your ankles? I'm going to go ahead and fill these at the same time too, okay? All right. I'll rate those at a 2 plus. Rating rhythm was good. I didn't have find anything abnormal with those either, okay? So the next part of this inspection, or assessment, I'm sorry, is going to be your gastrointestinal and urinary, okay? So first I'm going to inspect your abdomen for contour and symmetry. So can you go ahead and do me a favor and lay down? Alright, so the first thing that I'm doing is I'm looking at your contour and symmetry. So my patient would not be wearing a shirt, obviously I'd be able to, see it. Alright, so your contour and symmetry, it is symmetrical, and contour, I'd say, is within normal limits, okay? The next thing that I'm going to do is I'm going to go ahead and also take your bowel sounds, okay? What I'm going to do is I'm going to go ahead and listen with my stethoscope, with the bell, okay? And I'm just going to listen to see if I hear anything abnormal or if it's hyperactive or hypoactive. Hyperactive would lead to me thinking that you had something like diarrhea, okay? And hypoactive would lead me to thinking that you had something like constipation, okay? All right, so can you put your arms at your side for me? So when you listen to bowel sounds, you start in the right lower quadrant, okay? And then you work your way around in a clockwise manner, okay? All right. So when it comes to your bowel sounds, I didn't hear anything abnormal, okay? I would say that we're within normal limits. It wasn't hyperactive and it wasn't hypoactive. It was normal, okay? Your bowel sounds were normal. So now what I'm going to do is I'm going to go ahead and I'm going to palpate, okay? I'm going to softly palpate, which means just I'm going to kind of softly go in a circular motion, okay? And just feel around in your GI tract, okay? In the same motion that I just did. All right. Was that tender at all? Did that hurt? Okay, so my patient doesn't show any signs of tenderness, and there's no signs of any distension. Okay, you can go ahead and sit up for me, sir. So that's it for gastro. Okay. So next we're gonna go ahead and go into your musculoskeletal system. Okay. So I'm gonna first look at your elbow and wrist, and what I'm doing is I'm inspecting them. Okay. I'm looking at the symmetry and contour of your elbow and wrist. So I would say they're symmetrical when the contour is within normal limits. Okay. They look fine. Um, Next, I'm going to inspect your knees and your ankles, okay? I'm looking at the same thing, symmetry and contour, okay? You can go ahead and relax. All right, so I would say they're symmetrical. They look the same. It's the left one matches the right, and the contour is within normal limits, okay? Next, I'm going to assess your elbow and wrist for range of motion, okay? So with your elbow, you can only bend two ways, right? You can bend it towards you or away. So can you go ahead and turn it and push it towards you, okay? And then go away. All right, can you do that with your left? All right. Now with your wrist, can you go like this or like this? Okay. All right, that's good. All right, so now we're going to do the same thing with your knees and ankles, okay? Um, all right, so with your knees dangling in a neutral position, can you go ahead and flex? Bring your leg up. All right, and can you do that with the left? All right. And can you bring it down towards you, like towards your butt? All right. Now with your ankles, can you do the same thing you did with your wrists? Okay, and do it with your left. All right, very good. The last part of this is, well, the second to last part of this assessment is I'm going to check the strength now, okay? So what I'm going to do is I'm just going to apply pressure, and then you're going to just go against the pressure, okay? Go ahead and try to raise your arm. All right. Do it with this one. All right. Now, do it. Go down. Very good. All right, now do it with your wrist. All right, and down. All right. Now with your legs, push up, push up. All right, down. All right, and with your ankles, down. All right, very good. So I would rate your muscles. We're rated at 5 plus, okay, which is within normal limits, okay. Um, Now I want to check your sensory with your lower extremities, okay. So kind of like the same thing that I did with your face, is I'm gonna do with this cotton ball, okay. So I want you to just close your eyes and just tell me when you feel it, okay.
Yep. 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 Yep.
All right, very good. All right. Next, I want to look at your gait, okay? If you can you go ahead and stand up for me? And I just want you to take 5 steps that way and then take 5 steps walking this way. Just walk how you normally walk. Just normal how you normally walk. All right, you can go ahead and take a seat. So I'd say your gait is within normal limits, okay? All right, so that's the assessment, okay? Do you have any questions?
Nope.
No? Okay. So everything was within normal limits. I didn't find anything abnormal. I'd like to reassess your pain on a pain scale of 0 to 10, 0 being no pain, 10 being extreme pain. How would you rate your pain?
1 or 0.
Okay. Very good. All right, so no pain. All right, so I'm going to go ahead and put your bed in a locked position, okay? Put your side rails up. Make sure they're locked. Here's your call light. All right? You don't have any questions? Okay, well, I'd like to thank you for allowing me to do this. If you do have any questions, let me know. Or if you need anything, just press that call light and call me. Your bed's locked. It's in a low position. Side rails are up. You have your call light. And just call if you need anything. Thank you, okay? I appreciate you allowing me to do this. Hand hygiene, done.
So stupid.